Why did you choose to use an EMR?
Well, an EMR is basically the wave of the future. It's a great way to improve your documentation, to improve patient compliance and interaction with patients. It's also a great way for keeping records and for maximizing your time in terms of patients, in terms of callbacks, prescription refills, things of that nature. It's also really good for billing purposes because what I've come to understand is most doctors don't overbill, they underbill. So a system that allows you to actually have some confidence in your coding, for me, is priceless.
And why did you choose integrated healthcare solutions?
I have looked at a lot of companies, and software is pretty universal. I mean, any software can be pretty much customized. What I liked about integrated, I had local people. I didn't have to call out of state and wait for somebody to call me back or get back to me. The other systems that I've looked at, well, we'll get back to you within 48 hours. Well, if my office is in chaos, I don't have 2 days to wait for you to get back to me. So I like the fact that integrated was local. I like the fact that the people there were really responsive, that they were willing to come out and help. If you had a question, you got somebody immediately. So if there was a problem, you know that there's somebody that you can pick up the phone and call and say, okay, what do I do? This isn't not working out quite right, or I've forgotten how you do this. And so you've got somebody that you can literally call and get it at a moment's notice without having to worry about them calling you back and your system basically bogging down because you can't find anybody to help you solve this problem.
And how do you feel the customer support has been since you actually initiated using IHCS in your clinic?
It's been phenomenal. I can honestly say I have never called and not gotten somebody to respond to me immediately. If there's a problem and they can't solve it, well, we'll take your name, let us work on it, we'll call you right back. Usually within 20 minutes, I've gotten a phone call. This is what you're doing or what you're not doing. This is what the issue is, and it's solved.
How has having the system in your clinic impacted your clinic as a whole?
I think we're more productive. We're able to improve our documentation so that if we ever get audited or if there's ever questions, we have that. It's improved patient flow. It's improved our ability to get patients' medications to them. The patients love the e-scribe because they don't have to worry about taking paper. They go to the pharmacy. It's already there. It's already waiting for them. We're able to improve documentation in terms of our communication with other physicians, which is always good. And it helps streamline things. It helps our clinic move along faster.
What would your advice be to physicians that are hesitant to make the transition from paper to EMR?
Do it now. EMR is the way of the future. It's the way we're all going to have to go. My understanding is that down the road, reimbursements are going to be impacted negatively if you don't do EMR. And from my standpoint, the sooner you do them, the more comfortable you are with the system, the more time people can spend with you and show you, this is what you need to do if you're having a problem. The concern I have about a lot of doctors is everybody waiting up to the last minute and then trying to jump on at the same time, and you're not going to be able to get the one-on-one. You're not going to be able to have people be as hands-on if everybody tries to jump on at roughly the same time. So my recommendation would be the earlier that you can get started doing that, to go ahead and initiate that process.
And also, how do you feel that using an EMR will help you in the future?
Well, it's helped in terms. I think it will help in terms of patient scheduling. I think it will help in terms of patient flow and patient compliance because it's a lot easier to pull up records. You don't have the problem of losing charts and having to find charts. The office runs smoother. So patients are happier. They get in and out on their visit time more quickly. It's a lot easier to answer patient questions, to answer prescription questions, because you can just pull the system up right there rather than having to try to look for things. It improves my ability to follow up because we have lab queues that let me know when lab is ready so that I can go on and make sure that lab has been addressed. It's better in terms of monitoring follow-up, seeing who's been referred, who's actually kept that referral, what the results were on that referral. So overall, it's going to improve patient care as well as the clinical practice itself.
Tell me how user-friendly you think the system is.
Very user-friendly because I am essentially computer illiterate. I have never been one to do a lot on computer, but it's a great system. It's extremely user-friendly. I love the system. I do not have any complaints about it at all.
After looking at about 3, 4, 5 different agencies, integrated agencies to help us with our billing and our paperless environment, we had looked at, like I say, 3, 4, 5, and not only were they very expensive, they were not user friendly. I didn't get that feeling that the companies we were looking at really had our best interest at heart. And because we're a small business, I felt like they were geared more toward the big environment. And so when we started looking at integrated, there was a feeling that these guys really want to help us, not just help our bottom line, help their bottom line, but to help our bottom line. So after talking with them 2 or 3 times, not just one time, we decided to try and see what they were about. They came in. What I liked about it is the system is very user friendly, and for everything that we needed, they had it. For, I would say, a small percentage of the cost of most of those $60,000, $40,000, $50,000, $60,000 folks. And what we found is, they say you get what you pay for. In this particular instance, we got more than we were paying for, based upon these other folks and what they had told us about, their system. And their system was not user-friendly, and I can't hone in on that enough. This system that we have is very user-friendly. The training was excellent. There were no questions that we asked that weren't answered. And sometimes we asked the same question 2 or 3 times, and then I would say, oops, I asked that a few minutes ago, didn't I? But I got the same answers, which meant a lot to me. Being 60 years old, this is a top-notch program. I like it. I recommend it to anybody who's looking for something like this. Small business, large doctor's office, small doctor's office, clinics or whatever. It's a great system. I strongly recommend it. Call me if you don't believe me. I've dealt with computer folks for a long time, and a lot of times they can speak a language that's not common to this, that the average person doesn't understand. The tech support that we got, I would rate it on a 1 to 10, about a 9.99, which is as high as I would recommend anybody. Not only did they say call us if you need us, but when we called, they called us back. Or if we got them on the phone, it was then. It was 2 or 3 days after you want a question answered, but it was like, I need the answer now. I got it now. And in today's environment, that is very, very uncommon. The service that we got was tops. And if you rate the service and the program together, you can't beat them. That's just it. All of the guys, from the CEO all the way down to the person that actually helped us initiate the system. It's wonderful. I can't say enough about it.